Do you know what stress does to your energy levels? Find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Dr. Liz Cruz and I've got Tina Nunziato sitting right here by my side. And you might have noticed we have someone between us.
He's still here.
That's right. We have Naturopath Alvin Harbour with us. If you did not listen to the previous episode, you must go back and listen to it. Alvin is a guest with us and we were able to get him to hang out with us a little longer because there's just so much amazing information that we've been talking about. And so please go back, listen to the previous episode where we introduced Alvin and where he talks about his clinic and the different modalities that he has. So just to kind of recap though, he was talking about, so Alvin is here in Phoenix, here in Peoria, Arizona. I started going to Alvin about 6 months ago as a patient, and his clinic is called IVOLV Superhuman Wellness. Okay, and just amazing modality that he has. And we just touched on 3 on that previous episode, but he's got several other things that he does. So let's talk about stress, because everybody has stress. It's something that we all have in common. All sorts of things. I mean, we start out our days, most of us start out our days stressed out because all we're thinking about is what the day is going to bring. Some of us, a lot of us have to get up, get ready, go to work, go to a job. We have kids that we've got to get out of the house to get to school. Kids that we have to pick up after school, take them to their different activities, because our children these days must have a resume. Mm-hmm. And to have a resume, we've got to fill them up with activities, right?
Absolutely.
Yeah, so
But I remember when we did a study in our office of all of our patients, and there were even seniors that were stressed out. It's because they were worried about their kids all the time, their adult kids. And and if you're not stressed, it's almost like you're finding things to be stressed about. Even our kids today are stressed because we have them so busy. So it just seems like from birth to cradle to death, we're stressed.
Absolutely.
In general.
And so in our office, which we no longer have the practice, we closed it down just now in April, but we had our practice for almost 18 years. And through almost 2 decades of having this practice, we saw thousands and thousands of patients coming in with their gastrointestinal issues. We would work them up, do all sorts of testing, which could include blood work, CAT scan, doing a colonoscopy or doing an endoscopy to look in their stomach, and make sure that there was nothing bad going on, make sure that there's not a cancer. But then in our office, the other thing that we always have, that we've offered for over 15 years, was an opportunity for a more holistic approach. And we started incorporating a more holistic approach that we married to the standard gastroenterology approach that I was taught in all of my medical training. And so we started trying to help our patients out in different ways with supplements, including digestive enzymes, probiotics, detox greens, salts, even liver detox, especially for our patients with fatty liver. Tina and I started doing podcasts. We've been podcasting for over 10 years. So a lot of great free information. We've got over 500 episodes. We're providing books. We wrote a couple books together. Our son wrote a book. We started doing seminars in our office. Once a month, on a Saturday, we would do seminars, and sometimes we had up to 50 people in the room there at our seminars. And our goal was to try to help people from a more holistic approach. Do you have anything to add to that?
No, I think that's a great summary of what we've been doing.
Yeah, and so But it's a huge piece of the puzzle. However, it's not the only piece of the puzzle. There are many pieces, and through the years, we have collaborated with other people, with lymphatic massage therapists, with colonic therapists,
Energy healers.
energy healers. We've tried to always collaborate with other people, and if we had somebody that needed something that we didn't provide, then we would send them off, say, hey, go see so and so. So now we have this amazing person Alvin, who has this amazing, who has these amazing modalities, treatment, just, oh my goodness, I've just got to let him talk, that is something that can be, what would we call it, an adjunct, or that could be another piece of the puzzle, okay, to be an answer to people. Everybody is searching for, people nowadays, everyone's looking for the fountain of youth. People want to look younger. People want to feel good. People are tired of their digestive issues. People are tired of feeling stress, okay? The energy levels are so low because stress is an energy vampire, all right? It's an energy vampire. So what other things could we be doing to help with stress? Alvin, I'm going to let you talk here and see what, give us some of your thoughts on what we could do with what you have to offer.
Sure. I mean, we always recommend that some of the easiest things to do are just to breathe. And it's very difficult to breathe when your body's under a constant state of duress or stress attack, right?
Yeah, true.
We feel like we can't catch our breath. How many of you out there have been like, oh, I can't breathe today. For some reason, I just feel like this weight's on my chest and I can't breathe. I've been there many times. And it's a killer. Like it causes, the more and more that we have those experiences, the more it sets us up for the possibility of dis-ease, right? So then we have these things like autoimmune coming along and many, many other attacks on our system that keep us from living that life that we deserve. So some of the things we do in the clinic, we use vibroacoustics. We stack vibroacoustic therapy. You may not know what that is, but it's basically using vibrational frequencies pulsed through your bodies at a very low rate to help modulate the system or activate your system again, and just teach it that it's okay to finally relax. So when it starts keying off on your nervous system, it tells your body that it's okay. It starts to release different hormones, like, certain endorphins, certain dopamine and serotonin, right? So like they help the body truly just fall into that state of relaxation. So we can get out of that fight or flight or fear response, and we can actually drop into the nervous state that we're supposed to be in, parasympathetic. That's, if you've heard about brain waves. We live in this alpha beta world where we really need to be in the delta theta. Because in theta, that's where our body truly regenerates. And if we live in this constant state where we're always trying to hustle and always trying to get things done and always under massive amounts of stress, we keep ourselves out of theta. And theta is the only place where our body actually drops in to regenerate. So we age faster. You may not understand that, but you actually age quicker if you're under stress. That's why if you see someone who's been stressed out for even 3 or 4 months, they look excessively old.
Yeah.
But it's not forever. It doesn't have to be forever.
It's reversible.
We can reverse it.
Yes.
That's wonderful to hear, because I know we hear from patients all the time, like, it's too late for me, for different reasons. But it's not.
No, your situation is not your identity. So many people forget that. Just because you've been told something by someone that you have some sort of disorder, whether it be a mental or physical disorder, that is not your destiny. You get to choose. That's the fascinating part about how dynamic our body is. We can convince ourselves into health, or we can convince ourselves into sickness. You get to pick.
That's amazing, right? The mind.
So aside from the vibroacoustic mat for stress, I know you also do a lot of supplementation,
Sure.
peptides. Does all that play into the
Absolutely.
stress too? Can you talk a little bit about those modalities?
Absolutely. So we try to bring in a full system with people whenever we do a lot of different scans. We do blood work. We don't just do regular blood assays though. We do metabolic pathways testing where we understand the epigenetic expression, which is basically you're born with genes, and that's genomics. Now, if we test the genomics, it'll tell us a piece of the story. It can tell us, okay, there's certain things in your DNA pathway here that could possibly be activated. And if those are activated, then here's what's going to happen. It's a if that, then this, right? So just like old computer logic. Now, if we study epigenetics, we can understand which one of those genes are turned on. So you picture your genes are like this long hallway, and it has doors on either side. In each door is a gene. Now, if those genes are turned on, the light switch, then we understand what that gene means. We say, okay, well, that's the epigenetic expression. Now, why it's turned on, that's the real question. That's what metabolic pathways allows us to understand. So the study of metabolomics, we understand why the cell is actually turning those things on, and we look at the metabolism of different nutrient profiles based upon stimuli. So we can understand everything about your body, basically giving you a full body map, which we should be born with.
That's awesome. Yeah.
Yeah, most doctors aren't trained in those things.
No,
They're not talking at that level with patients.
Alvin, can we shift that? We can make changes in all of those pathways,
So
right?
about 4% of your genetics are set in stone.
Okay.
The rest of it, you get to change.
How fast can you change something like that?
Well, it's thought that it took maybe hundreds of years to change genetics, to actually evolve, right? But we're seeing it now, and studies are showing that we can shift our hormone levels, which transforms our genetics in a matter of moments.
Wow.
In a matter of moments. How does that?
Shocking.
Shocking, right?
So it's crazy because that means that every thought that I have, okay, whether I'm stressed out, I'm worried, I'm afraid, I'm like, whatever the thought is, I'm happy, I'm excited, all of that is affecting, like in real time, my genetics.
Yeah, and it played a huge role in your journey. Since the first time I saw you, what happened? What was the conversation we had when you came and sat down?
I'll let you share it. He showed me a picture of me like 6 months ago. I was like, whoa.
Who's that lady? She looked very stressed. Yes, she did. And you sat down in the massage chair, and we were talking. And I was like, you get to choose. You get to choose. And all the things in this world affect you if you let them. But they don't if you change the lens, right?
Yeah.
I tell people all the time, every picture looks blurry with a wrong lens.
True.
Change the lens,
Very true.
brighten the picture.
Yeah.
That is your reality. When we change our perspective on things, it changes not only how we see the world, but it changes us biologically. It'll change metabolism. It'll change how we go to the restroom. It'll change how we perform if we're going out for a race or if we're just doing our regular day.
Powerful.
Very, very.
How much control we have.
Yeah. Absolutely.
Yeah, we spend all our lives trying to control everything around us when the only thing we really need to control is this right here.
Yes.
Right.
Well, and that's what the other thing I wanted to bring up with regard to that is the investment that we need to make in ourselves.
Oh, yeah.
We have so many clients and patients we've worked with in the past who they're willing to put all their money into their kids or into their car, into their home, but when it comes time to work on themselves, they don't have the money anymore. I don't have money for that. And this should be the most important vessel that we invest in, right?
Yeah.
And a lot of people don't look at it like that.
There's a big reason why when you're on an airplane, through the safety briefing that they give you, they say, put your mask on first.
That's right.
You are of no help to anyone around you if you are dead.
That's right.
And that should be something that rings in everyone's mind right now.
Yep.
You are no good to anyone if you are not giving out of a full cup. So the excess is what is the best part of things that you can give to someone. If you are stressed, if you're undernourished, if you don't have enough sleep, and you're trying to help someone in your life, you're giving them the leftovers, not the sweetness.
Right. Not a lot of sweetness out there right now.
You know, it depends on what your lens is.
That's true. That is true.
Oh, that's awesome. Oh, so deep. Okay. I think that this is a good place for us to bring this episode to a close. A lot of great information. I think that, listen, you'll have this. You can listen to this multiple times. I know that I will. And but I get to see Alvin at least 3 times a week, so I get to actually see this light. So if you want to connect with us, you can find us on the web, drlizcruz.com. We've got a magenta colored button on the homepage that you can click and schedule a free 30-minute wellness consult. You can connect with us through email. There is a section with contact information, support at drlizcruz.com. You can connect with us that way. And, if you haven't rated us, please rate us and please give us a 5. It'll help other people just like you to find us faster. And lastly, if you haven't subscribed, please subscribe so that you never miss an episode. All right, well, stay tuned because we've got another treat for you. And so we will catch you on the next podcast. Thank you so much for joining us.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.